All right, welcome everyone. Thanks for spending some time with us this evening. This is 7 Simple Strategies for Successful Associateship. It's sponsored by Pacific Dental Services and offered to you folks as members of the next PDS. It's my pleasure to be your host for this evening. My name is Rich Groves and I manage the professional affairs for our organization, and in that capacity, one of the best things I get to do is introduce speakers like Dr. Velayo to you. This evening, Dr. Bianca Velayo will be our featured speaker. She'll be sharing her experiences and some nuggets that help you get squared away for your own transition into the profession, and has a private practice right now in Henderson, Nevada, is a Tufts graduate from 2015 and has an interesting pathway into the profession that she'll be sharing with you and some tips that you can take away as you contemplate your own transition. We're going to go for about maybe 40 minutes or so live with her experiences and look to square away a question and answer session at the conclusion of that event so that you can either pose questions in the chat, you can pose them in the Q&A, and we'll queue them all up so that at the end of her presentation, Dr. Velayo will be available to you to answer some of the things that maybe you've been contemplating and some advice that maybe she can share to help shape your own experience as you're ready for that transition. So without any further ado, it's my pleasure to introduce you to our speaker this evening, Dr. Bianca Velayo. Welcome.
Hello. Thank you so much, Rich. Hello, everyone. This is so neat that we get to all connect through webinar and video chat. As Rich mentioned, a little bit about me. I'm originally from Long Island, New York, and then I did my undergrad at Tufts University in Medford, Massachusetts. I decided to stay there and do my dental school. I graduated in 2015. Immediately upon graduation, I decided to pick up and move across the country to take up an associateship at a PDS-supported practice in Las Vegas. And so it's been quite the ride, and after a year of being an associate, I was offered a position to open my own practice with Pacific Dental Services. So now I am the owner of Green Valley Smile Dentistry, which is in Henderson, Nevada, and I've been here since July. So it's really special to be here talking to you all today, especially on a topic so near and dear to my heart. I feel so, I was just in your shoes not so long ago, and what's really neat is that I just started my associate, who's a new grad. He just graduated from USC in 2016. I just started him last month, and so it's so interesting to have seen myself grow in this past almost 2 years, and now watch him go through the same exact thing. So a lot of the things we'll be talking about tonight is relevant, and it's still very fresh and new to me, and I hope you all learn something and get inspired. So for today, this is our agenda, and all I ask is really if I say anything interesting, write it down. We'll have a Q&A later at the end of everything, but really at this time we're going to be taking in so much information, and if you can just doodle 1 or 2 things that you want to try to implement for yourself by the end of the session that you want to try to work on. And the biggest thing I've learned really the past year and a half is all about goal setting and really just identifying what your goals are, any action plans that will help you achieve your goals. And for you to be here on a Thursday night, really committing yourself to your future, I already know you already have all the skills and the mindset that just by writing it down will help you get there faster and achieve your goals faster. So a little bit about me and my dental school experience. As I mentioned, I went to Tufts in Boston, and I was really involved in my ASDA chapter. At the time, I didn't really know what it was. I thought it was just student government. I was the social chair, so I was just looking forward to planning our parties after the exam blocks. And I didn't realize it was part of this whole national organization affiliated with the ADA, which is the body that helps manage and govern our profession. And my first dose of really how amazing this chapter is and how lucky we are to be in the dental field that has ADA and ASDA advocating for our rights was the junior year, my junior year of dental school. I was lucky enough to be able to attend the ASDA National Leadership Conference in Chicago, and that's when I realized, wow, ASDA is a big deal. It's not just my school, it's not just all the Massachusetts schools, it's nationally. And it was great. I was able to meet so many different dental students from all over the country, similar to what we're doing right now at our webinar, but more face-to-face. There were tons of sessions to get me excited about dentistry, to be aware of the hot topics affecting our profession. I met a lot of dentists, and also at those events, there were a lot of recruiters and different organizations looking for new dentists to join their offices when they graduated. So it was great for networking, great for me to learn and see what my options were upon graduation, because at the time I really didn't know too much. I thought really all I knew about dentistry at the time was more private practice, solo practitioner. I didn't realize what else was out there. So it was really eye-opening for me. I attended a session there. It was led by a PDS-supported dentist. Her name is Dr. Katie McKim. And in her session, she was talking about all the advantages of working in a high-tech office. She was placing her own implants. She was really involved with her using CAD/CAM and making those same-day crowns for the patients. And she was a practice owner, and she was just a few years out of dental school. And I thought to myself, wow, I want to be like her when I grow up. And really, I didn't have too much time to grow up because it was 2 years until I graduated. So it really lit a fire under my butt, like, wow, I really need to start thinking about what I'm going to do to prepare for graduation, to prepare for life after dental school. And so after the session, I picked her brain. I said, hey, how can I be like you, more or less? And she said, definitely reach out to all the recruiters. Reach out to just network. She says, the more you introduce yourself to people, whether or not they're going to be able to help you directly either finding a job, they will help you, give you information to expand your knowledge, make you a better candidate, but also help guide you in an appropriate way that will set you up for a good position outside of school, whether it's looking for a new job or if it's for residency or, entering public health, whatever it may be. The whole idea is network, pick other people's brains and make those connections, and it'll help you to get where do you want to be. And so I made it my mission. At the end of that session, I said, everyone needs to know my name. So every recruiter, every dentist, every dental student, I wanted to, not only did I want them to know me, but I wanted to get to know them. And I found that this was really important as well. Sometimes we're also focused on, oh, who's that recruiter or who's that doctor who owns that practice I need to get to know. It's also important to make meaningful connections with your peers, because if you do decide that you want to do a residency or, your peers sometimes become practice owners themselves, and I've been finding my classmates are reaching out to me trying to hear about options to become a practice owner through PDS. But with residency, the residents are actually the ones who help pick the incoming class. So just the more that you're able to build your reputation, get to know everyone, it doesn't hurt, and it just helps you grow. And so I love this picture on the right, hashtag dental school rocks, right? We all think that dental school is the best, but I know that's not true, right? There's always so many ups and downs we go through, and sometimes we have that mindset we want to get in and out as fast as we can, but it's not like that. If you just focus on being and just doing the minimum, doing the requirements, then all you're going to be is just average. Really, you want to differentiate yourself, and it starts now. It's not just about when it's time to apply. Everything that you're doing right now in school, every case that you do, every interaction that you have, that's all helping give you the experience and the knowledge and the skills to help you be prepared for whatever it is that you want to do when you graduate. I remember when I was in school, the last thing I wanted to do, I was a senior dental school. I had already finished all my dental requirements, and the last thing I wanted to do was do another denture case because everyone hates removable. And I had a patient came in, needs full set of dentures. And I asked around, see if my classmates needed anything. Everyone was all set with their requirements, so I did it. And as much as it was annoying to do all the lab work and do all the steps for the dentures, not only was I able to make my patient really happy and make a great connection with my patient, but it was extra experience under my belt that helped me be prepared when I was able to handle all my denture cases in private practice. So that's my spiel on dental school. It's never too early to make those connections. I remember when I met with recruiters, met the dentist, I took down their information, and even though I was only a junior at the time when I went to the National Leadership Conference and it was still too early for me to get a job out of school, it was important for me to really cultivate those relationships. So every so often I would email the dentist or email the recruiter and say, hey, I just passed my board exam, or hey, I'm going to start my externship, or hey, I finished my clinical requirements. It's not bugging them. If anything, they really enjoy hearing from you and just celebrating your tiny successes and milestones. But how this helped me is that when it was time for me to apply my senior year of dental school, I had already built a relationship with the dentists and recruiters that they already knew who I was. And then when an opportunity arose, they knew they could call on me because I was always in their ears. So I advise you, take advantage of all your school's alumni network. Attend as many conferences as you can, whether it's your local ADA chapter or if it's the, ASDA regional conference in your area. Just get out there, put your name out there, get everyone's information, and maintain the relationship. And they'll remember you, and you can reach out to them as you get closer to time for graduation and say, hey, I'm looking for a job in Massachusetts. Do you know anyone, or are you hiring? And that's going to help differentiate yourself. But another thing I did, and I advise everyone to do that really makes you stand out, is set up a shadow day. Even if it's just half a day, let's say you have a light clinic schedule and you don't have anything going on that afternoon, email either your recruiter, email a dentist, and everyone's really welcoming to having dental students come in, and that really helped me really identify what it was I was looking for in my first job, because I got to see a variety of different practices, see a lot of different practice styles within the dentist, and so that way when I was able to go for my interview, I already had an idea, okay, is this a good fit? Is this the type of environment I wanted to go to? So if you have the time, make the time, set up a shadow day. All right, and so I finally was able to do my interview for my first position, winter of senior year of dental school. For the most part, most interviews won't really take place until your senior year of dental school. I know a lot of my classmates really waited until the springtime after they passed their boards, but for me, early bird the worm, and luckily for me, because I was able to start the process earlier, I was able to get set up with a wonderful position. And so I love this slide for me because it's so amazing. I was just on the other side of the spectrum. I was the interviewee just 2 years ago, and now I'm the interviewer as I am hiring new people for my office. And so things I'm looking for, and I know other practice owners are looking for when we're conducting interviews, really is we just want to know, are you a nice person? Are you approachable? Can me and my team stand being around you for an extended period of time? And do I trust my patients with you? If you can fit in that basic criteria, you don't have to be a major superstar. That alone is being a superstar. You don't have to be A+ student. You don't have to have necessarily done 1,000,000 crowns. I know we all think, at least me and all my partners and all my peers, we can teach you how to be a better dentist, and I was taught how to be a better dentist, a better clinician, but we can't teach you how to have the right attitude, and I think that holds true amongst everyone. So really just be yourself and let your true personality shine. One of the questions that you most likely will get asked at your interview, tell me about yourself. And that's probably one of the first questions to ask, because I know for me as an interview, that's my default. You're like, tell me about yourself, and then let me think about the next question I'm going to ask. But that's always, how do you respond to that question? And once again, you don't have to come up with this really amazing, superstar answer like, I was in the Olympics one time. We don't expect that. And that's not, to be honest, that's not too relevant to the job position. So really, in the interview, and when someone asks you to tell you about yourself, it's easy to blank here, or you don't know where to start. Just show your passion. What is it that drives you? I say that's a really safe way to answer the question, and that, me as an interviewer, makes me really happy to hear, like, wow, you're really passionate about something. I hope my patients see that side of you, or I hope our patients see that side of you. And so whether you're a parent, whether it's you're really involved in your community and your neighborhood and you really want to be part of this neighborhood for the rest of your life, or even as simple as why and how you joined dentistry and fell in love with dentistry in the first place. Show your passion. That's a great way just to fall back on a safe answer to answer that question. And like I said, the interview is most likely going to ask you that question in the first place. So if you beat them to your own response, there you go. You told them why you want to be a dentist. It sets the tone for why you're here today. So a couple of characteristics that really stick out to me, and like I said, other practice owners that I've talked to who are interviewing new associates, we look for, are you humble and hungry? Are you eager? Are you driven? Do you want to learn? Do you want to be a better dentist? That's number one. Next, are you ethical and comprehensive? Really going back to the idea, can I trust patients around you? Do you see the big picture? Or are you just more narrow-minded and focused on maybe money or whatever it is, okay? Are you confident in yourself, confident in your skills? We get it, even me, I knew I had a lot to learn, but you gotta sell yourself, right? So be confident. Are you coachable? Are you open to feedback? And are you passionate? Like I said, that's number one. That's gonna, you can't dispute passion. Okay. So, oh, see, I just got a note that no one can hear the presenter. Can you hear me? Can everyone hear me? Rich?
You're just fine. Bianca, go ahead. Your audio is coming through very clearly. There's one, I think, or two isolated incidents that we're troubleshooting, but you can continue on. You're just fine.
Only are we interviewing you, but you're interviewing the interviewer. The whole idea is you want to see if this is a good fit for you, right? Can you see yourself in this office, as a member of this team, serving the members of this community for an extended period of time? So be prepared, come with questions, research the area, research the dentist that you're going to be working with, research the neighborhood, get a feel for what it is that you're looking for. And this is where the shadow days that I mentioned really come into play, because the more that you're able to get information, you can formulate your own opinion of exactly what the ideal associateship is for you. That way you can ask the proper questions to make sure that it is a good fit for you. All right. And so, as I mentioned, I was offered a wonderful position to work with Dr. Cody Muggleson. He's a PDS-supported practice owner in Las Vegas. He has a track record for mentoring new doctors and developing them to become proficient clinicians, but also great leaders and business owners. And so I'm originally from New York. I have no ties to Las Vegas, but I said, let's try something new. This is a great opportunity. And so I really encourage everyone, sometimes you have to take a leap of faith, and if it feels right, just go for it. And it's the best move I've ever made, and I don't even think I'm going to move back. And so Dr. Muggleson is actually going to be leading one of these webinars coming up, so I highly encourage everyone to hear his side of the story. This is me taking Boston to Las Vegas, and either my staff is so afraid of me that I scare them all into wearing Patriots gear for the Super Bowl, or they respect me, but we have a great team environment, and I appreciate all that they do for me. So there's a couple of main things that we're going to talk about, something that I noticed myself struggled as when I was first started my associateship, and now I'm noticing that my associate is going through as well. And first is communication skills, and building that trust and rapport, and really managing your time in a new environment that's not in a school setting. So the first one we'll talk about is communication. Okay, I thought I was a good communicator. Watch me, I'm talking with your ear off right now. I'm clearly good at talking, but sometimes I fail to realize that when you're starting to treat patients, as a gabber myself, I'm so used to thinking you can just talk their ears off. It's more important to listen, okay? And it's also important to really think about the basics, like what is my tone of voice? What is my body language? What is the message that I'm really, that's coming across, not just my words? And so when you first meet a patient, it's so important to really establish the likability aspect, okay? Do they trust you? Do they like you? And so that comes across with the body language. So eye contact, firm handshake, soft tone of voice, really leaning in when you're talking and listening to them. And one of the biggest things I learned, and I know other dentists have told me about this as well, is when you're first meeting a patient, it's so important to ask questions and get them talking. If you can get your patient to talk, they will diagnose for you. They will tell you all of their problems, and it makes your job easier, especially when, as a new grad, sometimes you don't know where to begin. If you just listen, if you ask the right questions, the open-ended questions, get the patient talking, they'll tell you where to begin. And I think that's, it's magic, right? It takes the work, it makes it effortless for us to diagnose and treat because, you know, not only are we coming across as likable, that we care because we're asking questions and getting them to talk, but it also helps us make sure that we have the correct diagnosis. So remember, communication is not just the words that are being sent, but it's also the body language and the tone of voice. And not only is this important when you're communicating with your patients, but it's also important when you're communicating with your team. If you ever have to, if, for example, an assistant takes an x-ray that you don't like, it's not diagnostic. You don't just say, hey, you, that was a bad x-ray, right? What are they going to think about you? So it's all about the tone of voice. Hey, Taylor, I was reviewing your x-ray. I really need to get the apex on that so I can diagnose it better. Do you mind taking a new one? There you go. Body language, tone of voice, really makes a difference. And so building trust and patient rapport. I know for me, when I was in school, my professors mostly did a lot of the treatment planning and helping us phase the treatment. And sometimes for me, I noticed that you're so focused on finishing your requirements that you view more the treatment as a means to the end, like, okay, this is my requirement, I just need to graduate. And you forget that patient, you're there to help the patient, and it's not the other way around. They're not here to help you with your requirements. So it's so important to treat the patient like an individual, make sure that they come first. And, you know, once you establish that you're likable, once you establish that you care about them, once you identify what needs to be done, then it's up to you to make sure that you gain the patient trust, and that's going to help them feel comfortable starting treatment and really creating a patient for life and building your practice. I remember when I first graduated, I was so scared sometimes to tell patients that they needed extensive treatment because I was afraid of the backlash. You know, I tell a patient, hey, you need SRPs, you need a scaling and root planing, and sometimes patient would clap back and they say, why can't I just get the free cleaning? And that scared me, right? But remember, you have to treat the patient ethically, right? Is the prophy going to address their health? Is that going to help them restore their clinical health? No. So sometimes it's easy for me to feel like bullied, like, oh, I don't know if I don't want to hurt the patient's feelings, I don't want to get yelled at, and you back down. But remember, it's your degree on the line, and you're not doing a disservice to a patient for telling them what they need. And so always diagnose comprehensively, diagnose, you know, ethically, and if you treat your patient like your own family member, conservative but quick to solve a problem when you see it, then you'll never be wrong, okay? And so a different way to approach, I've learned, is sort of you gotta tell the patient what they need in a way that's relatable to them. I'm so used to speaking in a way that's really clinical because we're used to being shoved textbook jargon, like, Mrs. Jones, you have clinical attachment loss, and you have periodontal disease, and there's calculus on your teeth, and it just goes in one ear, out the other, and she's thinking there's math going on in her mouth, and she doesn't understand what I'm saying. And so I learned to break it down, and it's all about how is she going to understand? How can I educate the patient on what she needs? So instead, I say, Mrs. Jones, you have periodontal disease, you have a gum infection. The gums are detaching itself from the tooth, and it's leading to bone loss. If left untreated, you're going to lose your bone, and you may lose your teeth. Does that concern you? All of a sudden, I presented it in a way that she can relate to, that's clear, and she doesn't want to lose her teeth. So then she understands the value of scaling and root planing, and she will start the treatment. Okay? And trust me, there's always going to be times patients aren't going to agree with you, right? They're going to fight with you. They think they know better, but remember, you're the doctor, you have the degree. They're coming to you for a reason. So show that value. Another example that I've seen a lot in my practice, tell a patient, Mrs. Jones, you have a large cavity on this tooth. The tooth is broken. That tooth needs a crown. Mrs. Jones says, why can't you just do a filling? Remember, they're trying to diagnose them, okay, in the back of my head. If you had a dental degree, then do it yourself. But, they're coming to us. We have the expertise. So remember, don't back down. Sometimes patients will take advantage of our youth and our excitement, and they think that we'll change our treatment plan. But if you're wishy-washy and you change your treatment plan, you say, okay, you know what, you're right, let's do a filling, you're actually losing their trust. And they think, oh, then did I really need a crown? So you have to assert yourself as a new dentist, stand behind your diagnosis, stick to your guns. And if she says, you know what, I don't want a crown there, I don't believe that I need a crown there, I'm going to get a second opinion, you didn't do anything wrong. Your diagnosis was clinically sound. There's nothing to worry about. You say, Mrs. Jones, I understand. If you want to go get a second opinion, I welcome you to. And we'll be here for you whenever you're ready if you want to get started on that. You know that if she goes somewhere else, they're going to say the same exact thing. So you did not do anything wrong. Trust yourself, trust your skills, and, be assertive. And patients will appreciate that you were honest with them, that you weren't wishy-washy, that you didn't change your diagnosis, and that you treated them comprehensively. Like I said, you treat them like family. They will refer your family to you, and that's what builds your reputation, and that's what grows the practice, and that's what that turns into production, and that helps you get paid. All right, so I'm not going to lie, dentistry and my first year out was filled with ups and downs, and it's so important to know exactly why you're here, right? So really, I encourage everyone after today's session, write down exactly why do you love dentistry? Why are you doing this? What drives you? What are your goals? If you write it down, when you go through your down times, when I go through my hard times, you read through it and you're like, you know what? I'm here. I love dentistry. I want to serve my patients. I know I want to be a practice owner one day. I just got to keep pushing. And share it with others. Maybe it's with your spouse. Maybe it's with a close colleague or peer or friend. And that way, when you're venting to them, I had a really tough day at work today. I don't even know if I want to be here anymore. They'll say, no, remember, Bianca, you love this office. You love your patients. You want to be a practice owner. You love treating. You love doing dentistry. This is your calling. I know you're in a funk right now, but keep going through. So know what matters most important in your life, what drives you. There's going to be ups and downs. It's not easy, so manage your expectations. I remember when I first graduated, I thought I really wanted to hit the ground running. I wanted to get my office as soon as possible. I wanted to start treatment. I wanted my patients to love me. I wanted to be a superstar. And I fell flat on my face. It wasn't as easy as I thought. Like I said, because I was fumbling when I was talking to my patients, I was slow doing my dentistry. It was not a cakewalk, okay? And I was beating myself up. And so if you're able to reach out to others, those who know you well, when you're, for me, I reached out to Dr. Moselson, who is my mentor. The doc, I suck. I'm stressed. I feel like I'm never going to get to where I'm supposed to be. He says, respect the process. What you're going through is normal. I've seen it with he said he's seen it with all his other associates. Hang in there. You're good at what you do. It takes time, okay? So remember, it's not going to be easy, but if you have your support system, if you know what it is that drives you, you'll get through it, and you'll be better for it. And so time management is the biggest thing I feel like all new grads really encounter. I mean, we're so used to dental school where we have 3 hours to do an exam and a treatment plan, 3-hour blocks to do a crown prep, temp, impress, deliver. And it's not like that when you get into your private practice. Patients don't have all day to wait around for us to do everything. And so I remember I was really slow, and that was tough. But sometimes building speed definitely comes with time and practice. But a couple ways to get faster and things that helped me were, one, just asking for help, okay? Being open to feedback. My assistants that I was working with, they said, Doc, are you open to feedback? I said, yeah. I mean, you've been doing dentistry longer than I have. I'm open to listening to the assistant. Just want to get better. They said, Doc, when you're doing your preps, you're pausing a lot. You're stopping a lot in between the procedure. You are on and off with your foot pedal. And, I think if you try to do less breaks, that can shave off time. I said, okay. And I never even thought about that. I didn't even know what I was doing. You're thinking about so many different things when you're prepping a tooth. You just don't know really what else the rest of your body is doing. And so I took that to heart. And I tried to be more focused. I tried to take less breaks in between. I let my foot pedal run longer, and it made me faster. Another thing is just being aware of how long it's taking you. I really emphasize wear a watch, just because we're not going to be able to have our cell phones whip it out. Sometimes patients use that as rude, but also it's just hard to get in and out of your pocket if you just casually glance onto your watch right here. Okay, I'm timing myself. I started at 6:30. Let me see when I finish. Okay, it took me an hour to do that crown prep. Set goals for yourself, reasonable goals. Okay, this week I want to shave off 5 minutes. Okay, next week. So really incremental steps, being aware of how long it's taking you and asking for the feedback and help of your team members. That's going to help you be faster. And remember, patients do not want to be in the chair for a long periods of time. If you want patients to like you, if you want patients to come back, respect their time. I've learned that as well. And so providing excellent patient care is always going to be on the forefront of our minds. I mean, that dentistry, we want to be proud of the work that we do. We realize that it's not just a crown, it's a tooth that's connected to a mouth, that's connected to a heart, that's connected to a human being who is a mother and a worker. Remember, it's not just about what we're doing, it's a big picture, and we want to always be able to provide our patients the best. And you can't do it yourself. If you want to be better, if you want to get faster, if you want to be on the cutting edge of technology, to be able to be aware of all the advances so that you can offer your patients the latest and greatest, you can't do it by yourself. You have to have your network of dentists, mentors, join a study club, reach out to your local dental society. They offer CEs. I know the ADA has a CE portal that I highly recommend. Go check it out. Myself, we have a text message thread with all my dentist friends, and anytime there's a situation, we send x-rays and give them a little rundown. Hey, Doc, what would you do in this situation? And immediately, right, we're always on our phones, get a response. And it's great because, one, you get not only a second opinion, a third opinion, a fourth opinion when you're concerned about a case, but the openness, just being able to say, hey, I need help, that vulnerability, letting your guard down, it actually helps your peers as well, and they're going to be more open to share their mistakes, their flaws, their questions, and you can learn from them as well. And so I know I wouldn't be here if it weren't for the help of all my peers and my network. And so we've heard this time and time again, dentistry is the commitment to lifelong learning. Expose yourself to as many CEs as possible. Join your study club. Expand your network. This is the best thing I've ever gotten from a patient. It's not even what's the gift inside, it's the card. It says, you have changed my outlook on what it can be to go to the dentist. You made my experience pleasant. And that's what all we're trying to achieve with every patient. Providing excellent patient care, but also providing a great experience for the patient. Remember, sometimes they're not going to know what a good crown margin is. They're just going to know, did you treat them well? Did you get them out of pain? Did you care about them? So remember, it's not just necessarily, patient care is not just about the work, but it's also the experience in the patient. I remember when I first got out of school and I was doing some procedures and I was trying to prep myself, okay, I'm pulling a tooth tomorrow. What are the tools I need again? You know, there are plenty of resources online. You know, I even YouTube videos on NextPDS. There are plenty of videos and resources. So just make sure whatever you do, you want to make sure it's a good source. So, you know, peer-reviewed journals or university links. The more trustworthy the source, the better information it is for you. And so it took me about 6 months working in my associateship to really, until I finally started getting comfortable. And everyone has their own pace, and it was great. It was a great feeling, not having to go to work feeling scared or overwhelmed. I didn't have to worry about whether my crown margins were solid. I knew that was great. And then once you sort of establish that baseline competency, then you sort of start thinking about different things like, oh, I want to really work on the aesthetics of this case, or I want to start working on implants, or I really could have handled that patient better, right? It's constantly pushing yourself and setting the bar high and really trying to reach it and push yourself to be better, not only for yourself and your own ego and your own confidence, but also for your patients. And so, as I mentioned, I knew when I first started my associateship, I wanted to eventually open my own practice, and I knew I had to prove myself first. So once I knew my clinical dentistry was sound and my patients were starting to, you know, really respond well to me, and I was building my own reputation, which is very important, then I made it clear to my Dr. Muggleson, the owner dentist, and the operational team that supported me. I said, hey, I want to be an owner doctor. What do I need to do? And they set up a list of guidelines and sort of checkpoints that they wanted me to achieve to help prepare me. And this was not just dental, it wasn't dental anymore. It was more be a better leader in your office, help train the associates, help train the front office staff, lead the morning huddles, and then also learn more about the business aspect of dentistry. And so once I, you know, was able to start working on that, then I was lucky enough and fortunate enough to have been able to been offered this position. This new office was opening up, and I was able to be there for it. The topic of financial health and student loan debt, that's going to be touched upon next week. Dr. Patel, she's going to be leading a session on that, so I highly encourage everyone to attend and learn on how to set yourself up to take that next step. My advice for you really right now is just try to live as frugally as possible. I mean, I was used to just being my broke dental student and living in my tiny apartment and, you know, staying in a lot and not, you know, managing my budget. And so if you could live like a dental student your first couple years out and save as much as possible, you'll be better prepared so that you can achieve your goals of opening your own practice or whatever it may be. So it's been quite the ride for me, and here are some resources on the NextPDS that I highly recommend that you check out. It really delves deeper on a lot of the topics that we talked about today. And before we leave today, just a summary. Really, I hope everyone write down some goals for you today. Write down some action plans, what you're going to do today to differentiate yourself and get yourself better prepared for life after graduation and setting yourself up for success so you have the best picks for your first job or residency or whatever program outside of school when you graduate. Manage your expectations. Remember, it's going to be a roller coaster. And try to be as efficient as possible. You know, and always pushing yourself to be better than you were yesterday. So that's pretty much it for I'd be happy to open up the floor for any questions. I I did just think about another interview tip, so if anyone wants me to talk about that, if you have any questions, let me know. We have still 20 more minutes left in the session, and I'm happy to stay later, too, if we have a great conversation. So, Rich, I'll let you take it over from here to open the floor.
Thank you so much, Dr. Velayo. That was a really great series of recommendations for our guests. Really appreciate the insight. While it's fresh in your mind, let's take a moment, and the questions are starting to roll in at this point, but while it's fresh in your head, why don't you share that additional recommendation with our guests, and we'll get the Q&A started right thereafter.
Sure. So thinking about interviewing skills, there are a couple different types of interviews that you may encounter. So we're all used to just face-to-face interviews. And so like I said, be yourself, share your passion, tell them something that's not on your resume. But sometimes, too, you may find that the dentist may want to see how you treatment plan and diagnose. The dentist may give you a set of x-rays and then say, review these x-rays. I want you to come up with a treatment plan and then present it to me. My advice in that situation really relates back to time management and just really showing them that you're an ethical and comprehensive dentist. No one's throwing any curveballs at you. No one's going to be saying, I want you to do full mouth rehab. Most likely it's just going to be obvious things like there's a bombed out tooth. Can you identify gross decay? And can you come up with treatment options? So if it's an extraction, also, what are you going to do to restore the tooth, right? Comprehensive. You have to give the patient their treatment options. So extraction, bone graft, membrane implant, bridge option, removable option, do nothing, okay? Identify the cleaning. So remember your phase 1, which is, either prophylactic and emergency dental treatment, and then from there you can take it phase 2, phase 3. Don't take too much time on it, okay? And then when you're doing your case presentation as well, just keep it short and sweet and to the point. I've heard horror stories of dentists, in their interview, just talking their ear off for an hour. So that's where really tuning in on the interviewer's body language. If they're zoning out, wrap it up. So I thought I just wanted to put that in there for you. But yeah, question.
Okay. Your first question from Aaron asks a great question that I know that you've spoken to me about in the past, Dr. Velayo. How did you take on the challenge of being the newest member in the office while trying to establish a leadership role in that practice?
That's a great question, especially it's funny because I guess I wasn't as introspective when I was going through it at the time, but now that I'm going through it with my associate, it's a balance, okay? First and foremost, I'd say just try to be as open and humble as possible, really respecting the experience that your team members have to offer, but at the same time, not letting them bully you, right? If they're like, Doc, we have to do it like this. If you don't agree with that, just say, I respect that, but this is the way I'm going to do it, and that's it, So sometimes you do have to be firm, and I know sometimes it can be there's two spectrums, right? Sometimes new grads, they'll feel like really authoritative and be sort of like a jerk and be like, I'm the dentist and I'm not going to listen to anyone else and I'm not going to take feedback from anyone else because I'm the doctor. And then the other extreme is they want to just be a pleaser and they want to be everyone's friend, and you have to remember you're the dentist, so you are naturally already in a leadership position. And so really just helping out wherever you can, and even just something tiny like, I'm going to read the morning huddle today, or that helps establish your leadership and gain everyone's respect.
Next question for you. Patients in dental school are aware of your slower speed when they're in your chair. How do patients in private practice take it when you first are starting out working in that environment and your speed at that time while you're in that part of the learning curve?
It's really, really tough. I mean, especially because most patients don't want to be anyone's guinea pig, and so I have a baby face, and so they always ask, you look like you're 16. How long have you been doing this? And you always have to just include the clinical time that you had in dental school and say, oh, I've been treating patients for 2.5 years now, 3 years now. And so it's almost a fake it till you make it. Good news is it shouldn't be as long as it takes you in dental school, because you will be working with an assistant most likely in your first situation, so you don't have to worry about suctioning, And the idea of delegating as well. I mean, you're not going to be doing the prophy and the x-rays and the treatment all at the same time. The assistants are going to help you be faster. They're going to pass the tools to you. So just by having an assistant there, you're automatically faster. Also manage your patients' expectations. For the most part, patients don't really know how long procedures take anyway. So if you know you're going to be longer, you say, okay, well, you're going to be here today for 2 hours. Meanwhile, if you know a more experienced dentist is going to be an hour. Just manage your patients' expectations, and as long as they know what they're in for, they're not going to be upset with how long it's taking you.
Okay, next question from Karen. How did you bring up the conversation about compensation and the best time and way in which you think about negotiating?
Sure. So this one's a little tough because, you know, sometimes when you're coming, for me, I was coming into Las Vegas, which is a very competitive market, and it's already an established market, and so really the market really determines what the average compensation is going to be. A good way around that, just to make sure that you're getting a good deal and that you are getting paid at market value, is just ask around. Ask any dentists that you know who are working in the area. Talk to the associate, if there are any associates who are interviewing with you at that office. Just ask, hey, how much, you know, do you mind if I ask how much you get paid? And negotiation is always flexible. I should say be upfront. Say, let's say they lowballed you, and they're like, okay, you're going to get started at $10, and you talk to your friends who's working in the same market and they're getting started at $20. Then just, you know, send an email, say, or give them a call and say, I noticed that, you know, I've talked around to other dentists in the area. They're getting paid $20. I would like to be compensated at a fair, you know, something that's reasonable for the market, and open the conversation. Let's say you're getting paid on par with everyone else and you want something more. Say, okay, I would like to request this. Don't be afraid. The worst you know, once they already offer you the position, you know, you have that, at least you have that security that it's locked in. And, you know, the worst case scenario, they say no, but at least you tried. And it's just good practice, because there will be times, again, that you're going to want to negotiate and ask for more, whatever it is, either more pay or less, or more days, or whatever. It's good practice to have those difficult conversations. So I just say just ask and be forthcoming, and hold your ground, and be prepared for the worst, but do your research first. Excellent.
Your next question, Dr. Velayo. For the new graduate who's kind of contemplating this transition, are there certain areas from a clinical skills standpoint or CE courses that should be top of mind that they should be thinking about prioritizing as they make this step themselves?
I'm sorry, can you repeat the question?
When a new graduate is contemplating their transition into practice, are there certain courses or skills that they should be thinking about from a continuing education perspective?
Really, I would say identify whatever it is your weakness is. If you're not good at endo and you want to be doing, you know, basic endo in your skill set, then you may want to focus on that. If you know you're not good at crown and bridge, or for me, like, I had to learn CEREC. I didn't really do a lot of that when I was in school, so I did a lot of CEs on imaging, designing, prepping CEREC crowns, because it's a little different than how we learned with PFMs and stuff like that. So really just identify whatever your weakness is. Also for me, I took a lot of classes on patient management, right? How to effectively communicate with patients. So really identify whatever it is that your weakness, and go that way. And it never hurts to get any extra communication CEs or patient management CEs.
Now, from the standpoint of networking, and you were talking about being consistent in your approach throughout your third and your fourth years, when's the right time that they should be having these conversations about shadowing and networking and exploring some of these opportunities? Is it too soon at any point?
No, I really think there's no such thing as too soon. Like I said, it's all about just relationships. And, you know, the earlier that you're able to get out there and shadow or meet other dentists or dental students or residents or whoever it is, it's just more information for you to help get an idea of what it is exactly that you want. And as I mentioned, for me, when I went to Chicago, my junior year of dental school, and I was already asking, hey, I want a job, they'll tell you if it's too soon, and most likely, even if you're, but it doesn't, they're not discouraging you from reaching out. It's just more like that's just an opportunity for you to harness your relationship and really let them know what you're looking for, and just learn as much as possible. Every person from a professional standpoint can play a great role if you utilize them properly. So it's never too early. Start now.
That sort of dovetails into the next question that I see posed for you, Dr. Velayo. When you're thinking about an associateship position, how do you learn some of the things that they're interested in? Is there a way to sort of look into that practice from the outside before you're seated across the table from you as an owner dentist, an employer dentist?
Sure. So like I said, if you are able, if you know anyone who's already working in the office or nearby, that's always good, just so you can get an idea for demographics. Google, I mean, I'm a good stalker, so I just try to, you know, Google search either the doctor who you're working with or the office, see if there's, or go to their Facebook page, see what types of stuff they're sharing on their pages, the office Facebook pages. That way you can just get a little bit of a feel, see if there's any mission statements listed anywhere, you know. But if it's more of a very, very secluded office and there's not a lot of information on it, then you might not find too much, and so you just have to maybe come up with some generic questions and try to utilize the interview process to get as much information as possible because you weren't able to do any research ahead of time. But, yeah, the internet is all our best friend.
I bet. I have another question that's kind of interesting from the standpoint of your employer agreement and the restrictive covenant. When you're thinking about an agreement for the first time, besides the restrictive covenant, what else should a fresh graduate look for? What was it that you wish you knew when you signed it? Your own.
Well, honestly, I would just recommend to have a lawyer take a look at it for you, and that's the biggest advice everyone gets because it's a lot of jargon that you don't really know. So yeah, the restrictive covenant, non-compete, that's pretty, you know, those are really, really the main ones that, and if you have any questions, what's nice is a lawyer can help you advocate for you on your behalf. But for the most part, like I said, if you have any questions and you don't want to hire a lawyer, ask them directly. What does this, ask your the future employer directly, what does this line mean? No one's trying to hide anything from you. No one's trying to, you know, pull a fast one. They should be able to explain if you have any questions. But those are really the main ones. Compensation, yeah.
When you think about your associate that has recently joined your practice, were there any questions that you fielded that caught you unexpected as they were considering coming aboard?
Were there any questions that he gave me that were unexpected, you mean, as he was starting?
Yes, correct. Or perhaps another way to look at it would be, how did he differentiate himself in your eyes?
Okay. So my new associate, he was just so passionate, just driven, and he made it very clear that he wanted to learn and wanted to help be my partner in this office because I'm at a brand new office. So I sort of, like I let him know, okay, we're starting up. It's going to be tons of up and downs. It's going to be so important that we make sure we develop our relationship with our patients because that's establishing our reputation in the community. So like I said, the interview is a two-way street. He knew what he was getting into with me, and so I just really appreciated that he was up for the ride. He wanted to be there with me. He was really excited. Just because like I said, dentistry is full of ups and downs, and it's a roller coaster, and he had such a contagious energy, positivity, willingness to learn, that I was like, he's going to be such a great fit in the office, because I know it's easy sometimes when we're stressed to feel like negative, right? That's sometimes my MO when I'm overwhelmed, or I say I'm passionate and I'm stressed. And so it was just nice to have a ray of sunshine to add to the dynamic of the office. So I wasn't just looking at him as a dentist, but I was also looking at the role he would play in my office and the dynamic he'd have in my team. So yeah, he was really clinically confident. He says he's had, really great with his restorations and stuff. So that, that really came across, and I was impressed for sure by him.
Here's a nice pivot for you, Dr. Velayo. This one I know you're going to enjoy answering. One of the questions we've just heard is that there's some horror stories that students hear while they're in school when it comes to a dental supported organization's practice, with perhaps some quotas and production requirements. Production nil was the question specifically. Is any of this true? And why did you pick PDS versus a smaller owner's private practice?
Sure. So my biggest advice, so I actually wrote an article on this, so if you want, it's, if you go to my website, it's, I wrote it for the ADA New Dentist blog, basically just uncovering the misconceptions associated with DSOs, and based on my experiences working at a PDS-supported practice. And this is the biggest thing I know for me. When I told people I was going to work at a PDS-supported practice, people thought corporate, oh my God, why would you do that? But the biggest advice I have, it goes back to really shadowing, doing your research, talking to the dentist, talking to your peers who are in whatever environment that you're looking to go into. You can't listen to all the rumors, because they're not true. And I'm not saying it doesn't happen, right? But the same idea of being unethical, or the same idea of being like a production mill, can also be seen in a private practice. It's not just exclusive to DSOs. It just so happens that that stigma is associated with DSO. So just research. For me, I went out, I spent 2 days at PDS-supported practices, and for me, I could not differentiate that practice with any old other private practice that I shadowed at, and that was amazing for me. I did not have any connections in dentistry, and so I love the PDS model, that allowed me to be a practice owner and have that support early on in my career. So really, I'm not here pushing for PDS. I just say research, research all your options, whatever it is that you're doing. Don't let, stereotypes hinder you from a potentially amazing opportunity. And that goes with anything. I know if you're applying for a residency, research it. Not all residencies are the same. So you can have a good experience, a bad experience. So the more information you have, the more you're able to talk to people, the more you can even get in yourself and see what it's like, then you can make the decision for yourself. You're not relying on hearsay. You can make the decision for yourself. It's not like that at all. For me, I'm very autonomous. No one's pressuring me to do anything. I diagnose everything myself. I stand behind the dentistry that I do, and that's it. But I can only speak on my experiences, and I know all of my peers and all their fellow practice owners in Las Vegas and in PDS feel the same way. I don't know what everyone else says. So like I said, just research and make the decision for yourself.
Yeah, as much information, I think, is the sound approach for everything, and determine what's most effective for you in your individual goals. Yeah, for sure. Well, folks, we're drawing to the top of the hour here. If there's any last questions, I know Dr. Velayo's made herself available to continue this dialogue. If you have any last questions that we'd like to pose to her during our time together, I'm trying to leave that window open just a brief moment further. But if you don't have any further questions, I'm going to take a moment to thank her so much for her time and her insight. Dr. Velayo, it's really been a pleasure hearing you and learning from you this evening. You've provided a variety of things for us all to think about as far as our next steps are concerned and the transition into practice. Really appreciate it. Thank you so much.
Thank you. And then I will be sharing all of my contact information. I want to make myself as available to you. Like I said, I wouldn't be here if it weren't for just help from other people or picking their brains. So if I can be a resource for you, I have my email, my website, and my mailing address. So we'll get to that slide later.
You've got a lot of thank yous that are arriving on our chat window too, and people who are mentioning their appreciation, echoing my sentiments as well. So if you let's advance that slide so that they can find how to track you down afterwards if they have additional questions or thoughts. So appreciate you making that available to them. And everyone, Dr. Velayo has displayed not only her practice URL, but her personal email, so that if you have any further questions, she's really been generous with her time, not only tonight, but extending that engagement to you. And I encourage you to use her as a resource. She's a really terrific speaker and one of the rising stars that we're going to see in this industry. I did share her blog with you in the chat window too, if you want to see that experience or continue that exploration at your convenience. One last thing, if you wouldn't mind, our webinar next week features Dr. Janki Patel, and she is going to be speaking particularly on the financial component and some of the leads that Dr. Velayo teased out for us this evening. And on her behalf, I thank you all for your time, and if you would be so kind as to just share your thoughts in the survey that we'll be presenting to you in just a moment when we close. And certainly thank Pacific and their support. Without the support of Pacific Dental Services, we wouldn't be able to bring you this fantastic speaker and this great information. So thank you on behalf to the team at Pacific, and Pacific Dental Services wishes you all a great evening. Thank you so much for your time tonight, folks. And Dr. Velayo, we really appreciate it.
Thank you so much. This was a blast, though. I hope you all had a great time, and feel free to reach out if you have any questions, concerns, anything like that. This was great, so thank you again.
Thanks, everyone. We appreciate your time, and have a great evening. Bye-bye now.